Hi, I'm Dr. Chris Hughes. Welcome back to Dental Implants 101. The next topic I'm going to discuss is I hate my denture or partial denture, and how can dental implants help? So I get that question all the time here in my office. So we can talk about the partial denture patient first. First of all, this is a partial denture. What I find is that people don't do well with these. This is what I would call 19th century technology. And partial denture is something that's removable, as you know. As you can see, it's got metal, it's got clasps, and it has to fit in the mouth. And most people have real problems with these things. In my practice, what I typically see is about 80% of the people that have these, they wind up in a drawer somewhere after a year or two. And then they don't have teeth to chew on, and this doesn't seem to be a good solution for them. So what can be done for a person that's missing teeth in the back usually? Could be in the front though also, like in this case here. What can be done to replace a partial denture? Well, if the teeth are very healthy, then it's just a matter of replacing a segment of teeth. So in this case, what could be done is, again, you could put a few implants in, do an implant bridge, and here are the implants. This is an implant bridge that's replacing 3 teeth. You have 2 implants, and it replaces a group of teeth. Now, this would be ideal, but you have to understand that the other teeth still need to be healthy. In many cases, what I've found is that if someone has been wearing a partial denture for a long time, say 15, 20 years or more, what we tend to see is that over time the partial tends to break the other teeth that it hooks onto down. And so in a lot of cases, their whole dentition is breaking down. Okay, so the partial is one thing, it's not working, but the rest of the teeth aren't working either. So in a lot of cases, people that are wearing these are going to wind up in a full denture, okay, which is obviously something like this. But we know that this is a problem because this doesn't stay in the mouth. So frequently what needs to be done is, if we want something that stays in the mouth and that you can chew on just like natural teeth, not like a partial denture, but actually like having natural teeth again, then we need to think about an implant supported bridge that would go across the whole mouth, okay, and replace the whole dentition. So in this case, we're seeing that we have about 5 implants in the lower jaw, and that the implant supported bridge, not just a segment of teeth, but actually replaces all of the teeth here. It replaces 12 teeth with 5 implants. This typically is going to give patients or give people a lot better chewing ability, way beyond what they had experienced back when this was new and they were with having partial teeth here and back teeth replaced by a partial denture here. Because even when this was new, this thing moved around. They had to tolerate this bar and so forth. With the implant supported bridge, this doesn't move at all, and they can chew and eat and enjoy their food and enjoy their life and feel whole again, just like when they had their natural teeth. Another option, obviously, is a snap-in denture for people that have a loose denture. This is a very relatively simple process of just putting in a few implants and putting the snap attachment into the denture. This will at least hold the denture in. Another interesting question that comes up is, when it comes to dentures, if I had to choose, where would I want to have dental implants? Would I have them in the bottom jaw or in the top jaw? And what I always tell people is, if they're going to need to replace their whole dentition, they're typically going to get a lot better results with the top denture. And the reason is because the top denture covers the whole palate, and they can get suction out of the top denture, okay? The lower denture sits in the floor of the mouth, and the tongue is in the floor of the mouth. and the muscles of the tongue form the floor of the mouth. So when the tongue moves up, the denture is dislodged like this, okay? And what people typically have to do is balance the denture between their tongue on one side and their cheek on the other, and then when they get food on the top, they try to bite down on that and balance it between there. You can see that that would be pretty difficult to do. So, but that's what denture wearers do. The only answer for a full denture to make it more retentive is to use denture glue or fix-it-in. Another aspect about wearing dentures is that over time, the jawbone will resorb. So this shows us how a jaw is with natural teeth. This shows us over time how the bone resorbs. And as we get older, if we lost our teeth when we're young, you can understand that with less and less jawbone, if a person is wearing something like this, there is just no way that this is going to stay on the ridge. After they lose their teeth, sometimes they can get more retention from a ridge, but as they age, the ridge declines and declines and declines, and so it makes it very difficult for the denture to stay on the ridge. Now, even in these severe cases, dental implants can be placed to help secure the denture. So again, even in cases where we've lost bone over a period of time, in many cases there's still enough bone to put a new set of teeth, a new dentition on top of the resorbed ridge with implants to hold those in and get your chewing ability and enjoyment of life back to like it was when you're in your 20s and 30s. Thank you for visiting us, and I look forward to talking to you again.